purposeful. We do more with less. Today, we recognize and celebrate individuals and organizations who live that every day, and we highlight the very best of what rural New Yorkers accomplish. Thank you for joining us to honor their outstanding work. I also have the honor of introducing you all, many for the first time, to NYSARH's brand new Executive Director, Jennifer Muthig, who will be our host today.
Great. Thank you so much, Allie. Good morning, everyone. I am excited to be here on the first of what I hope is many Rural Health Days as your Executive Director. It has been a whirlwind these last 5.5 weeks, and I'm humbled and honored of the trust and the spirit of community that you've all shown me this far. As Allie mentioned, I will be your host today and celebrating all things rural. And I'm going to give you a little assignment to think about during our time together today. So after we wrap up honoring our award winners, I'd like to open it up to any pictures or words if you want to drop in the chat about your favorite things about rural New York. Or if it feels more authentic to you, I invite you to come up on screen and tell us. So before I turn it over to our friend Karen Madden, I wanted to share something about my love for rural, because that's why we're all here today, right? Talking about our love of rural New York. So now some of you who know me, and I look forward to getting to know each and every one of you, but for those who don't, I wanted to share a little bit about my background, my love of healthcare policy, and how it led me here today. I'd like to introduce you to my OG rural health champion, my grandfather, William Wild Bill Muthig. Now, if you'd like to know how he got that name, please drop me a line and I'll share that story. This photo is my grandfather right after he got really sick. And to speak to Allie's mention of resiliency, when he couldn't walk the farm anymore, that did not stop him from riding a four-wheeler everywhere, giving us directions. Fun fact, according to my grandfather, there's only one way to stack hay, apparently. I remember things like our neighbor Robbie down the road would come and bag grain after he finished milking his cows. And John around the corner would make sure that there was an endless supply of cinnamon donuts from Stewart's on the large round kitchen table, so that my grandfather could hold court when neighboring farmers would come by to visit and check in on him. He passed away in 2011, and it's days like today that I'm reminded of that kindness, the sharing of resources, and taking care of one another in our award winners and nominees today. So we do so much together, and oftentimes with such little resources. Imagine if we had more. Rural is amazing, so let's work together to do more. I am thrilled that our friend Karen Madden, Director for the Center for Healthcare Policy and Resource Development at the New York State Department of Health, is giving our opening remarks today. Karen, thank you so much for your time today and all that you do. And talk about somebody who does so little or so much with so little. So Karen?
Thank you, Jennifer and Allie, for that introduction and for inviting me to do this welcome today. I really appreciate it, Jennifer. Welcome to you. I know you and I haven't had a chance to meet yet, but welcome to you to National Rural Health Day and all these great celebrations. I just want to talk a little quickly about how the origins of National Rural Health Day and kind of how it came to be. It is sponsored by the National Organization of State Offices of Rural Health, and I was fortunate to be part of the team that initially developed all of the thoughts and ideas that went behind it. And the reason that we thought that we should do a National Rural Health Day was because many of us had worked in rural health for many years, and all of you have as well. And I think you all know that we often hear about what rural health doesn't have and what it can't do. And we wanted to flip that script and celebrate all of the really great things about rural health and all of the things that do happen, because I think rural is really a hotbed of innovation in terms of what can happen when communities come together and when health systems have to think outside of the typical box of what they think they can do. And we first started talking about National Rural Health Day a good many years ago, and it has really blossomed into a nationwide celebration of all of the good things that happen in rural. So I'm thrilled that NYSARH uses this opportunity to recognize the good work that's happening across New York State and to present these awards on this day. I think it's a perfect combination of celebrating all of the good things in rural health and all of the good things that are happening across New York State's rural communities. So once again, thank you very much to Allie and to Jennifer and to all of NYSARH for all of the great work that you're doing. And thank you all for joining us today, and congratulations to the award winners.
Thank you, Karen, so much for that reminder. It's really important to your point that we are celebrating all the great things that are happening every single day. So now I'm excited that Tracy Geneva, who's Governor Hochul's Central New York Regional Representative, has come today to talk a little bit about rural health and Governor Hochul's policy priorities.
Well, good morning, everyone. And thank you for allowing me to join you today. As mentioned, my name is Tracy DeGenova, and I'm the Central New York Regional Rep for Governor Hochul's office, which means I cover Onondaga, Oswego, Cortland, Cayuga, and Madison counties. So if anyone needs my contact after this call, please don't hesitate to reach out. I'm more here today to listen. We are all watching what's happening and living, kind of day to day and bracing ourselves. And I can read off, numbers and statistics. But I'm here today to listen to all of you, to take back to Albany what I hear from you because your input is so important. And we're all so appreciative of the effort of this organization. I feel slightly, with DOH on the call, who is definitely more well-versed in, our policies. But, I did want to share the news that, we did submit our application for, rural health transformation, a $1 billion application to include initiatives for rural community health integration, strengthening rural communities with technology, and investing in technology and cybersecurity enhancements for rural New York. So I'm very appreciative of the opportunity to be a part of this celebration today, to be part of acknowledging these honorees, and I'm very much here with my notepad to take notes and take anything back. So thank you very much for having me, and I'm looking forward to the rest of the conversation.
Tracy, thank you so much. As somebody who is also one of listening to her, I think that's exactly the right thing that we need to be doing right now. We really appreciate your time. As a former regional rep, I know how busy your time is. Tracy was also kind enough to get us a proclamation from the governor, so we'll get some pictures of that and make sure we share it afterwards. But we just appreciate your support and being here today with us, Tracy. Thank you. So before we get started with our awards, I did want to thank our NYSARH Board of Directors Award Selection Committee, Melissa Wendland and Aidan O'Connor, for their thoughtful review of this year's nominations. Each year, we receive many inspiring submissions that remind us of the incredible work being done across rural New York. So I just want to give a quick shout out to those folks and thank you for your support and careful consideration of this year's awards. So on to the award ceremony. So our first award this morning is the Dr. Gary Ogden Rural Health Practitioner of the Year Award. This award honors the legacy of Dr. Ogden, a man known for his passion, dedication, and service to his community. Candidates for this award exhibit the same qualities we witness in Gary: a passion for life, selfless dedication to their community, organization, and especially to their patients, a strong sense of truth, and the conviction, belief, and action to make dreams a reality. This year's recipient truly embodies those same values, and I'd like to bring up Dr. Erica Scott to say a few words about our award winner.
Thank you, Jennifer. Hopefully you can hear me all right.
Mhm.
So lovely to be here with everyone. I'm Dr. Erica Scott. I serve as the Deputy Director of the New York Center for Agricultural Medicine and Health, or NYCAM. It is my honor to introduce the 2025 recipient of the Dr. Gary Ogden Rural Health Practitioner of the Year Award, Sue Ackerman. Her nomination was put forth by my colleague and NYSARH board member, Anna Meyerhoff. And Sue holds a special place in our hearts, and we are so pleased to be sharing her with you today. Sue is on the eve of her retirement from NYCAM and from our parent organization, Bassett Medical Center here in Cooperstown, New York, after a nearly 40-year career as a nurse, researcher, and for decades, our center manager. Throughout her career, she has been a champion for health and the well-being of New York's agricultural community. Her work has touched lives in countless ways, from conducting follow-up visits after serious farm injury and fatalities, providing compassionate support to families, to leading outreach and education for rural youth at safety day camps and for adult agribusiness events. She's brought health screenings and vital health services to rural fire departments through on-site clinics, skin cancer screenings for farmers and Anabaptist communities, and she's delivered thousands of flu shots and COVID vaccines at local businesses, including many, many farms. If you've seen a photo of Sue vaccinating farmers alongside some cute cows, you know her dedication goes wherever it's needed. Sue is more than a nurse. She's a farm wife. She's a dedicated mom and grandmother. She's a trusted advocate. She is a source of comfort for our staff and for clients alike, and a tireless force for good in her community. Her kindness, compassion, and unwavering commitment to rural health makes her the perfect reflection of Dr. Ogden's legacy. So please join me in congratulating and celebrating Sue Ackerman, the 2025 Dr. Gary Ogden Rural Health Practitioner of the Year.
Great, thank you, Sue. Would you like to come up and say a few words?
Wow. It's a true honor to be nominated and to be awarded. I'm grateful. I'm emotional. Excuse me. I'm so grateful for the opportunity to have worked doing something I love, along with people who truly have a passion for the rural community. It's just been a dream job, really. And 3 weeks from tomorrow, I'm done. But I'm sorry, I'm overwhelmed. Thank you very much. Very grateful.
I don't think you ever have to apologize to this group of people for loving rural and loving what you do. I will say, when we were reviewing your application and just looking at these pictures here, just seeing the love that you do, and going to farm workers and meeting them where they're at, I think it's just so crucial to people who preventative care, who maybe wouldn't have gotten that. So I love this, and thank you for your reaction and demonstrating that your love of rural.
Well, thank you so much. I just want to add that it's been a privilege to work alongside people who just share that same passion for the rural community, whether they're researchers or our occupational health group, our education group that's out on the farm all the time. So it's been a true joy and a joint effort.
Oh, well, we're going to have to move. I don't know how I'm going to move on to the next one, because you've also made me emotional, but congratulations, Sue. Congratulations on your retirement. Do you have any exciting plans coming up?
Hanging out on the farm and, doing chores with my husband and spending time with our 8 grandkids and 3 adult children. So, and answering phone calls if needed.
Well, I'm sure we'll still need to call on you and your expertise, but again, thank you so much and congratulations. And we appreciate all of your efforts. Thank you.
Thank you for all that you do.
Well, thank you. So our next award is Outstanding Rural Health Program of the Year Award. This award recognizes a community-wide, regional, or statewide program involving one or more healthcare professionals or entities that promote or facilitate the development of the rural healthcare delivery system. So I'm excited to bring up my friend Pat Fontana at the Fort Drum Regional Health Planning Organization to say a few words about the amazing work the team is doing at the Jefferson Lewis BOCES program.
Hi, thank you, Jennifer. Can everybody hear me okay?
Yes.
Great. So hello, everyone. It's good to be here with all of you. So a little backstory on this. I think it deserves a backstory. So a few years ago, several of us across the region, we met to talk about a workforce problem and a potential opportunity to address that problem. I mean, as you know, our healthcare system is facing ongoing workforce shortages in many roles, but LPNs is one of those top shortage areas. Now, at the same time, we have right in our backyard the Fort Drum Army Base, where we've got highly trained medics, and they're transitioning out of the military every year, but they transition out of the military with knowledge and all that experience that closely aligns with the work that LPNs do. Yet, in New York State, those medics were not given the credit for that knowledge or that experience towards civilian licensure. So in other words, if transitioning military medics wanted to become an LPN in New York State, they would have to start from scratch, as if they had no prior experience at all. So a group of stakeholders came together. And that included Jeff Lewis BOCES, Cheryl Mayforth at the workplace, Fort Drum representatives, Jefferson County Economic Development, I believe, the Workforce Development Institute, NAHAC, and us at FDR-HPO. And we came together to discuss the possibility of building a bridge program that would recognize the experience of military medics that are transitioning into civilian life. and doing that by creating an expedited pathway for them to become LPNs in New York State. You know, this would be fair to them, and it would also help to address the region's nursing shortage. So what came out of that collaboration was exactly that, an expedited medic to LPN program that allows transitioning medics to become LPNs in just a little more than half the time it takes a civilian with no experience to become an LPN. So now this program not only recognizes the skills of transitioning soldiers, but it also helps to keep them working and living here in our community, and we desperately need that. So obviously once they transition into the civilian workforce. Thing is, our biggest challenge at the time when we started this discussion was who the heck is going to do this? Who the heck was going to develop and implement this new program? And that's when Jeff Lewis Bosey stepped up, and they willingly took this idea on, and they made it a reality. Nicole Davis, I believe, led much of that curriculum development work, and she was supported by Jeff Ginger, Randy Fulkerson, and then Superintendent Steve Todd, who just recently retired. And I'm sure I'm missing several others at Jeff Lewis Bosey's who were an integral part of this. But the bottom line is that they accepted the challenge to take this on. And it's something no one had done yet in New York State. And they just turned it into a fully approved New York State expedited curriculum. So they took a rural workforce challenge, they identified a solution, and they made sure that it manifested into a reality that's now going to serve this region for years to come. So congratulations, Bosey's, for this award and for a job well done.
Yes.
Thank you, Pat. I think that continues to go with our theme today of doing so much with so little and being innovative and working together as a team to accomplish an overarching goal. So Jeff, Nicole, Randy, if any of you are on and would like to say a couple words, we'd love to hear from you.
So I'll jump in for a second. I'm Jeff Ginger. I'm the Director of Career and Technical Ed here at Bosey's. Nicole did tell me she has lots to say, so I'll try to keep my comments brief so that she has her opportunity if she wants it. But in the spirit of rural healthcare and what we talked about, the Jefferson, Lewis, Hamilton, Herkimer, Oneida Bosey's is the largest Bosey's in New York State of the 37. By about 50% in terms of land area, not in terms of population. So you all know that when you're working in rural anything, especially rural healthcare, distance is always a giant driver of how we do business. And working together across all of those communities to try to create opportunities is one of our main goals. So medic to PN is very important. I also wanted to highlight the fact that we've been able to grow a high school EMS program in our Lewis County Center that was not popular in our region, in partnership with Lewis County government a year ago. Again, a lot of those students will end up in healthcare careers, but they had a shortage of drivers for those large distances in rural spaces. So there's those pieces. We've also grown our practical nursing program in that region, our traditional practical nursing program, so that we've been able to enroll and graduate what will be close to 20 by the time the year's over since we started it. So just lots of things, but at the end of the day, the conversation is really about partnership. And when you're talking about sharing resources over vast spaces in rural areas, I think partnership, community, and being neighborly is really tied into all of that. And we don't do any of the good work that we do without our partners at the Fort Drum Regional Health Planning Organization or at the Jeff Lewis Workforce Development Board and all of the other partners Pat mentioned before. So we're very grateful. Thank you.
Thank you, Jeff. Nicole, we want to hear all the words.
I'm not going to go on and on. This was a very big project for us. So this was a very big project that took us a long time to do, a lot of hours sitting and calculating what the medics training looks like, what our program looks like, looking at other programs throughout the country. Ours was the first one in New York State, but we certainly couldn't have done this without all the partners that have been mentioned. And that includes the Office of the Professions. So they really did understand and meet with us and the Department of Labor and understand the importance of this program in this area and being a new pilot program within the state. And they really did help us navigate through this process so that at the end we could, develop it so that we have something for our soldiers to keep them in the area and help us in rural healthcare. So I want to thank everybody. It's an honor to be nominated, and it's an even bigger honor to actually be awarded this and recognized. So thank you.
Well, thank you for all the work that you've done. It sounds like an amazing program and something that can be replicated, especially your work with licensure. That's no easy feat. So we definitely commend you. Thank you so much. I don't know if Randy, if you wanted to say anything.
I'm good. I appreciate everybody that nominated us. And like Jeff and Nicole said, all of our partners, we can't do it without them.
I'm sensing another theme here, partnership. So I love that continued collegiality, work together. So Jeff, Nicole, Randy, and of course, Steve, hopefully he's enjoying retirement, and Pat and Cheryl, thank you so much for the nomination. This is really highlights again of what rural does best here. So our next award is the Senator Pat McGee Rural Health Award. This award is named after the late great Senator Pat McGee in recognition of her unyielding commitment to improve rural resident quality of life. As someone who worked with Senator McGee in Albany and in conjunction with the selection committee, we really had two nominees this year that stood out to us, both achieving that, going beyond, and who have made major significant improvements to rural health populations that we knew we had to deviate from the norm and honor both individuals. So today we're doing a little bit different. Instead of having one nominee or award winner, we're going to have two, and both kind of represent two different sectors, but both were just doing such innovative things that we really felt it warranted to have two co-awards this year. So first, I'd like to invite Dr. Brett Harris to say a few words about our first co-winner, Linda Battaglia.
Thanks, Jennifer, and thanks to NYSARH for recognizing Linda for this award. I couldn't think of anyone more deserving. Of course, there's really a lot of people deserving of awards on this call, but when I saw this announcement actually at the NYSARH Summit in September, I said immediately, because that was the first time I heard about the award, was that I needed to nominate Linda for this. So essentially, Linda is the Director of Mental Health and Community Services in Genesee County. It's a really huge job. Essentially, to put it into like a more understandable term, she's the mental health commissioner, essentially, of the county. But she goes outside of the county with collaboration and really works within the GLOW region. So Genesee, Livingston, Orleans, and Wyoming counties. And, we all think about what we try to accomplish. We have these high hopes to get things done, and it's not the easiest thing to get them done. And it takes these intangible things essentially to get them done. A lot of that is collaboration and relationships, and also having a drive and a passion for the work. And that's Linda. So in my work with Linda, I kind of realized that she has those intangibles. And as I've talked to different people throughout the region and doing some of the work that I do, they say the reason that we were able to get all this done is because of the great leadership in Genesee County. And then they just start talking about Linda and how great she is and how she has these great ideas. And we just listen to her ideas and we go with her ideas, and it makes us more efficient and more effective, and we get things done. So beyond that, I also wanted to mention that she kind of has her finger on the pulse of some things that are like emerging issues. So you can see on the slide there, like expanding GLOW Out, which is an LGBTQ drop-in center in the region, in the GLOW region, as well as identifying and responding to crisis situations and emergency situations. So I think that Linda has all of those things and a real passion. And I'll just kind of end by saying someone who, for their birthday, would like to travel to Albany from the Buffalo area to Albany to do a week-long train the trainer and behavioral threat assessment and management. Very excited about that. Is really deserving of this award. She's very passionate about her work. So Linda, congratulations on the award. It's so well deserved, and we all appreciate the great work that you do.
Thank you, Brett. Linda, would you like to say a few words?
Yes, thank you. It was a great training, Brett, in Albany on my birthday. It was great. I loved it. Thank you very much. I'm very appreciative and humbled to be nominated and to receive this award. So thank you for that. I'm just going to repeat some of the incredible buzzwords that I heard, by our opening remarks and some of our award recipients. We know the challenges that rural counties face. I think, in working in a rural county and being in the role that I'm in, it is really important for me to ensure that we are out in the community and the community knows that we're available to help them. But it really does take collaboration and partnerships, and it takes a group of people to do the work. So as much as I may have the vision of doing the work, it really is the people in the community, the mental health department and my incredible staff there. It's the county manager's office and the community services board allowing me to see the vision and kind of clearing the path for me to do what I need to do. It really is the people in the community that are dedicated to the services, right? That's professionals and clinicians, it's survivors, it's farmers, it is people with lived experience. It is, while we may not be very wealthy in treatment providers and services, we are extremely wealthy in the number of dedicated people that we have in the county willing to do the work, wanting to do the work. And that really is what makes it possible. So I am humbled to receive the award. I definitely cannot do it in a silo, and I am extremely grateful to the county and all the providers and the community members of Genesee County. So thank you very much.
Thank you, Linda. And I hope you don't mind that we added in a couple of quotes from your nomination form that to me just really stood out. And I just want to read them because especially when we look at, again, how hard we work to accomplish our goals in rural New York, I don't know where she gets the time in the day. So Linda, if you have any TED Talks about how we can accomplish more, what kind of coffee you drink, we'd be open to that. But and then the other thing of, when she comes asking for something, we almost never say no. So clearly the tenacity that you have and the compassion that you carry with you has clearly made a difference for decision makers. So we'll continue to follow you for any advice that you have. But I just really thought those two things were worth calling out. And I love that about you and look forward to getting to know you as well.
Thank you very much. I appreciate it.
Yeah, congratulations again, Linda. So our next co-winner, again, doing amazing things in the field. I'd like to bring up Heather Roman to say a few things about our co-winner, Dr. Sornicola.
Good morning. Thank you, Jennifer. As you can see, we have most of our staff here at Tioga County Public Health, and was without hesitation that Dr. Sornicola was well deserving of this award. And truly, he exemplifies what it means to serve in a rural county. His unwavering commitment has been shown through serving high quality dental care on our Smiles dental van, where he has been one of the sole providers, if not the sole provider for dental services on our van for over 2 decades. Thousands of children have been served and adults during his time on the dental van, where he provides his services for dental care, not only on our dental van and our dental program, but he also serves in the Tioga County Correctional Facility and the Broome County Correctional Facility as well. Recently, we had to extend his hours, or rather he volunteered to extend his hours as a part-time dentist because we needed to have extra patients be seen. So he did that out of the goodness of his heart. So Tioga Smiles through Dr. Sornicola is the only dental provider in our entire county that accepts clients with no public funded insurance as well as private insurance. And we are the last dental provider that will accept Medicaid in our rural county, helping serve those underserved or vulnerable populations. Thousands of children and hundreds of adults would not receive dental care without Dr. Sornicola helping with this assistance. So it was clear that Dr. Sornicola was the provider of choice for this. It's without hesitation that he deserves this award. Congratulations, Dr. Sornicola.
Thank you, Heather. Dr. Sornicola, would you like to say a few words?
I think she is. You wanted to say something about the clapping?
Okay. Yeah, well, thank you very much for the award. I did not know that I was even nominated, so thank you, Heather and Dennis, to all folks at Tioga County Health Department. It's quite an honor. Special thanks to the dental team here, Cole and Kim and Patty and Janice. It is a team effort, and without them, it certainly would not be possible. So it is definitely appreciated, and thanks again.
I think that speaks volumes to the work that you do, Dr. Sornicola, that you didn't even know that you were nominated. So I will say congratulations and thank you to you and your team. The selection committee was especially moved by your delivery of dental services, especially for children who would go without. As we all know, there's a shortage of dentists who do accept Medicaid, and the reality is that not everyone has the same access to care, transportation. We know in rural New York that window shield time to get to their children to dentists. So we appreciate, and again, you represent what best of rural has to offer. So thank you so much to everybody who attended today. I know time is very competing across the board, and the fact that you've come and spent time with us is amazing, and we really appreciate that. Your work strengthens communities across New York. We know and thank everybody for making today's ceremony possible. Our team here at NYSARH, Karen Madden and Tracy DeGenevia for coming and speaking on behalf of your entities. And I just wanted to give a couple of plugs for things that we have today. So at 1 o'clock, we have Dr. Carrie Cochran-McLean, who is the Chief Police Officer for the National Rural Health Association. She's going to provide some federal updates from both Congress and the Trump administration. I did catch this session in early November at the Northeast Rural Health Association, and Carrie does a fantastic job of breaking down HR 1. And of course, we know with the government shutdown unwinding, she's going to have some things to comment on that today. So if you haven't signed up for it and you want to, Holly's going to go ahead and drop that link in the chat. Additionally, our development team here at NYSARH is taking part in Giving Tuesday. All funds raised will support programs that NYSARH provides. And if you are so inclined to give, Holly will drop that link to the giving page. And just remember, together we are stronger, healthier, and more connected. So again, thank you so much for everybody for joining today. We're happy to stay on. And as you recall in the beginning, I kind of gave you all a little assignment that we're going to end our call today and time together talking about what your favorite thing about rural New York is. So if you want to drop something in the chat, or if you want to drop a picture, or if you want to raise your hand and come up on screen, we'd love to hear from you. Oh, thanks, John. Easy the people. Thank you. We love that. Community. That's so true. We can't do anything without each other. I think this webinar is a very good example of that. It took an army of people in the background to make this happen. So thank you to our team for all that. Agriculture, the partnerships and community support. Our farmers, yes, Tina. The rural beauty and knowing our neighbors, yes. Anything that has you excited about where we can take rural New York into 2026? Oh, Allie, I love that. The ability to work through and sometimes work around to solve problems. As a fellow loophole finder, I appreciate that. Helping some of our most vulnerable populations, absolutely, Jeff, especially in your neck of the woods, literally. Increasing broadband satellite access. I am excited about that too. I'm hoping that broadband access will hopefully continue to grow and that capacity program funding will come down from ESD. That's something I think will make a huge difference in our rural communities. All right, I just want to thank everybody again for spending your first part of National Rural Health Day with us. I'm excited again as my first time for Rural Health Day as your executive director. I'm happy to stay on. We do have the time scheduled to 11 o'clock. If anybody wanted to talk about anything or get to know each other, I still got a little bit of coffee left in my mug, but happy to hang out with you a little bit. And I hope everyone enjoys the rest of your day. And thank you so much for your time and your commitment to advancing rural healthcare policy. Thank you.